Hi, Dr. Saxena here, and in the series of what best I can give to the patient, and I'll be giving some kind of simple stuffs which usually help. I think a lot of people, and the key kind of people who come to me usually in the geriatric age group, all of them they have some common symptoms, whether they are undergoing some they are going some problem with the neural issues or with your arthritis or your cancer or cardiac issues. One thing which is commonly found, it's a very incredible common problem in all of these people is constipation. Yeah, it is a very common thing in this part of the world also. Usually people may experience constipation due to the foods they eat, and because of the lifestyle choices and the kind of refined sugars people are indulged in these days. The kind of we call it something like flour, or there's something like wheat flour, which is finely kind of something like maida. We have a refined wheat flour. So these are all the things which are reasonably enough getting into it. There are, I'm talking about a general population. There are some people who do present with constipation, and we are, as a medical doctor, we are bound to get into the depth. If needed, we need to go for a scans and all that, or try to go for a colonoscopy to rule out any major problems. But most of the people, when they work on this particular thing, they complain with usually 3 or bowel movements per week, fewer than they usually have hard dry bowels, stools, hard lumpy stools, kind of difficulty or pain while passing stools, and some people have got their bloating. So yes, it has a serious negative effect on the quality of the life, as well as physical and mental health. The person who is constipated, I can understand. This is we have seen some of the cases where there is a chronic constipation in autistic kids and all that, where you had the ammonia level shoots up like anything. I had seen recently. 7 days the child is not passing motion. I have seen in elderly age group, they are taking a lot of things. I just this is one of the reason I'm talking today is I happen to there's a senior person, I'm dealing with his kind of foot ulcers, not healing foot ulcers, and he's telling me I've got constipation for so long, and can you do something for that? So this segment is dedicated. I think there are some bullet points I'd like to give you. You need to drink more water. What happens is that being dehydrated makes the person more constipated. To prevent, you need to take enough water, and you should be staying hydrated. That's the number one, this one. So what happens is that you can always, there are a lot of studies which showed there is what exactly this, some things like carbonated drinks, sugary soda and all that, they are not at all good for the constipation. These people, these things can make constipation worse. The colas what are available and all that, and absolutely the simple water will make the difference and people usually with something like irritable bowel syndrome find that this carbonated drinks worsen their symptoms, and so that's the one thing. Second one important thing is something like eating more fiber. I would like to go in detail about what I'm talking about. That's a simple prescription which goes with me all the time, and I'll be talking in detail about that thing called isabgol. And this is one of the things which we always talk about fibers. We talk about something like insoluble fibers and soluble fibers. Insoluble fibers are there in something called wheat bran, vegetables, whole grains. So this helps to add bulk to the stools, and add easily, and the stool passes easily through the digestive system. There are something called soluble fibers. Soluble fibers are present in the oat bran. You have got something like barley, you have got something like nuts, seeds, lentils, peas. There are a lot of some fruits and vegetables which has got soluble fibers. What the soluble fibers do is absorb water and form a gel-like paste which softens the stool and improves its consistency. Nothing like oat bran, barley, you have got this kind of things. The non-fermentable soluble fiber which I was talking about, this is called psyllium husk. Psyllium is called isabgol in Hindi. This is one of the commonest thing I would like to write. Psyllium is usually it's a common name that refers to a number of plants that all belongs to genus Plantago. The plant seeds are harvested and used as a dietary fiber. The hulls or husks, the kind of husks are the part of the seeds used as a fiber, and they are commercially used as a dietary supplement. In North India, there is a lot of growth of psyllium plants, and it prefers the psyllium. These plants prefer cool and dry climates. So this is easily sold, very cheap thing. It is sold in different kind of things. Now a lot of these people, whatever is available over the counter, it has got psyllium husk in that. What are the benefits of this psyllium husk? It relieves constipation and mild case of diarrhea, and it's the most important thing with the psyllium fiber is it's insoluble, and so what happens is that what goes in must come out. It can be beneficial in this regard for stimulating the peristalsis. If you struggle with constipation, psyllium or products containing meat is the one thing you should always look into that. So what are the takes like? Psyllium is helping lower the cholesterol in the people, number one, and lowering the cholesterol is somewhere, I believe this is one of the simplest trick where I can work it out, lowering the cholesterol without particularly putting unnecessarily on any kind of medications. So most of my patients who are struggling with this cholesterol issues and all that, the simplest thing is the psyllium husk, the satis of gold. And I think over a prolonged time of period, it makes a difference in lowering the blood pressure, lowering the blood glucose levels also, and high BP as well. Again, I must emphasize here, this psyllium is also a prebiotic, which means it helps. It's a prebiotic, which means it can help stimulate colonies of beneficial bacteria inherent in the digestive system. I think some another things what I always look working with this psyllium is it helps in weight loss. Because it contributes to that feeling of satiety or feeling full, and this may help people who has cravings and hunger in those trying to lose weight. So this is one thing which is a part of my detox diet in almost all the patients. I always make it sure, let them take this particular stuff. The most important thing about this psyllium is it binds to the mycotoxins, it binds to the toxins which are liberated when we do the detox, which are what happens is that when we are trying to work with something like a patient is sitting in the chamber and starts detoxing in a chamber of far infrared sauna. That's the most simple thing. We try to do some IV vitamin C's and some detox and all that. So what happens is your organ of excretion is your liver and gallbladder. So through the gallbladder, it gets the things which are the toxins which are being released into something like intestinal tract, and with this intestinal tract, there has to be something mechanism when this we give the psyllium husk with this particular stuff. The intestinal toxins which are released with the through the gallbladder into the small intestines, and when we have a fiber, so insoluble fiber in the form of psyllium, all these toxins are absorbed. We use charcoal and we use this particular stuff. All things are absorbed into the intestinal tract, into that in the lumen, so that once this is absorbed, there is nothing which is it doesn't go back. Like what happens is that if we don't have a mechanism where if I start detoxing a person without giving him this particular stuff, there's no mechanism. Whatever things come out through the gallbladder into the small intestine, it gets enterohepatic recycling happens. There is a kind of enterohepatic reabsorption happens. So it passes a small part of intestine. Again, it gets absorbed back into the system. So you, by giving this psyllium and all that, you are effectively preventing that particular stuff. I recommend 5 to 10 grams of psyllium for everyone. If they are doing detox or if they are not doing detox, it's a different stuff. But this is one thing which is a simple hack, and I strongly advise people should get into this habit of taking this psyllium or something like that. Constipation, you should always look into some other areas also. I don't expect people who are in a geriatric age group, they don't have the time to exercise and all that. But exercise, if we are able to exercise, and that is one thing which is helps in movement of the bowels. This was basically, though there are a lot of amazing products available. You have got Senna, you have got probiotic foods, you have got a lot of coffee, and there are a lot of other prescription laxatives and all that. But I would like to prefer something which is very safe, totally it's insoluble stuff, and that makes the kind of thing which everyone can easily follow. And we are trying to look into some kind of prevention, and we believe that this particular thing, just by helping you out not to get constipated, is the simplest. It's a very simple goal, but reducing your cholesterol, trying to manage your glucose levels also, it makes a big it's a choice of thing for us. And these are the things which I somewhere started writing about this, and people have understood what we try to work it out. And apart from the simple things what we provide, like magnesium, trying to supplement magnesium, trying to see that that is one thing is and the other part, I try to in my practice, I try to ask people who have this constipation and all, ask them to avoid something like dairy foods and dairy milk and all that. That is one thing which is a simple thing to be looked into. And this is all about how to work out with this thing called constipation. And yes, there are some this is a simple hack, and I can always go still on and on. I believe it is a you need to look to a medical doctor, and this is a whatever I am trying to put across is just a kind of we are trying to share the information. This is not a piece of medical advice, and most of the people they can always follow simple advices, and this is all in the prevention segment. I think you must all understand that particular stuff, and I hope this segment you people are enjoying, and I'm quite happy to share with these small issues. and yes, small issues make sometimes a problematic thing. Thank you.